Hello and welcome. Today we're diving into a condition that affects the eyes and tear drainage system, dacryocystitis. We'll explore what it is, what causes it, how it's diagnosed, and what can be done to treat it. So, let's get started. Dacryocystitis occurs when the nasolacrimal duct, the drainage pathway for tears, becomes blocked. This blockage can be congenital, meaning present at birth, often due to an incomplete opening of the duct. In adults, it's typically caused by acquired obstruction. This can be due to a variety of factors, including bacterial or fungal infections, nasal polyps, trauma to the nose or face, or even tumors. Sometimes, the cause remains unknown, and it's simply referred to as idiopathic. When the nasolacrimal duct is blocked, tears can't drain properly from the eye into the nose. This leads to a backup of tears and stagnant fluid in the lacrimal sac, which is a small pouch located between the inner corner of the eye and the nose. This stagnant fluid creates an ideal environment for bacteria to multiply, leading to infection and inflammation of the lacrimal sac. In chronic cases, the sac can become distended and form a mucocele, a cyst-like structure filled with mucus. In acute cases, the infection can spread to the surrounding tissues, causing cellulitis. While precise epidemiological data can vary depending on the population studied, dacryocystitis is generally considered a relatively common eye condition. Congenital dacryocystitis affects a notable percentage of newborns, often resolving spontaneously within the first year. Acquired dacryocystitis tends to affect adults, particularly those over the age of 40, and it is more common in women than in men. Certain factors, such as a history of nasal infections, trauma, or nasal surgery, can increase the risk of developing the condition. The telltale signs of dacryocystitis include excessive tearing, also known as epiphora. You might notice a constant overflow of tears from the affected eye, even when you're not crying. Redness and swelling around the inner corner of the eye are also common. There might be tenderness or pain upon touching the area. In acute cases, you may observe purulent discharge, a yellowish or greenish pus-like substance coming from the eye. Sometimes, pressing on the lacrimal sac can cause regurgitation of pus or mucus through the puncta, the small openings in the eyelids that drain tears. Diagnosis typically begins with a thorough eye examination by an ophthalmologist or optometrist. The doctor will carefully assess your symptoms and examine the area around your eyes and nose. A dye disappearance test may be performed, where a drop of dye is placed in each eye to see how quickly it drains. Delayed or absent drainage in the affected eye suggests a blockage. Sometimes, imaging studies like a CT scan or MRI may be ordered to rule out other causes of obstruction, such as tumors or bone abnormalities. Dacryocystitis can be broadly classified into acute and chronic forms. Acute dacryocystitis presents with sudden onset of severe symptoms like pain, redness, and swelling. Chronic dacryocystitis is a more long-term, persistent condition with milder symptoms like excessive tearing and occasional discharge. Another classification is congenital versus acquired, as described earlier, depending on when the condition developed. Treatment for dacryocystitis depends on the severity and type of the infection. For acute infections, oral antibiotics are usually prescribed to combat the bacterial infection. Warm compresses can help to soothe the area and promote drainage. In some cases, incision and drainage of the abscess may be necessary. For chronic dacryocystitis, or when conservative treatments fail, surgery may be required. The most common surgical procedure is dacryocysterinostomy, or DCR, which creates a new drainage pathway from the lacrimal sac directly into the nasal cavity, bypassing the blockage. In infants with congenital dacryocystitis, gentle massage of the lacrimal sac may help to open the blocked duct. A lacrimal duct probing may also be performed to open the blocked nasolacrimal duct. While not always entirely preventable, especially in congenital cases, there are steps you can take to reduce your risk of acquired dacryocystitis. Practicing good hygiene, such as frequent hand washing, can help prevent infections that could lead to a blockage. Promptly treating any nasal infections or inflammation can also be helpful. If you experience any trauma to the nose or face, seek medical attention to ensure proper healing and minimize the risk of complications. The prognosis for dacryocystitis is generally good, especially with prompt and appropriate treatment. Most cases of acute dacryocystitis resolve completely with antibiotics. Chronic dacryocystitis may require surgery, but DCR has a high success rate. Recent research has focused on minimally invasive surgical techniques for DCR, such as endoscopic and laser-assisted approaches, which offer smaller incisions, faster recovery times, and reduced scarring. There is also ongoing research into new antimicrobial agents and alternative therapies for managing dacryocystitis.